Welcome back. The COVID-19 pandemic has taken a toll on our local hospital systems. At first, there was a need to secure more personal protective equipment for frontline workers. However, now hospitalizations are on the rise, and Essentia Health has a message for Northlanders this morning. We are connecting live with Dr. Jon Pryor, Essentia Health President. Good morning, Dr. Pryor.
Good morning. Thanks for having me here.
Yes, thanks for taking the time. I'm sure you're very busy over there at Essentia Health. How are things going at the hospital?
They're going okay, but things are tight. Our resources are being challenged, and we need help right now from the public. We're asking them to do their part in this pandemic.
Right. So are you guys seeing any shortage right now of workers or maybe even hospital beds for patients in need?
Both workers and hospital beds, both. We've got enough PPE right now, but our workers, just because of the community transmission, we've got workers who are out because they have COVID, and the rate of being diagnosed with COVID is going up. There were over 5,000 cases yesterday in Minnesota, the third day in a row of over 5,000 cases, and there were 31 deaths yesterday in Minnesota. So the positivity rate, this is if you do 100 tests, how many of them come back positive, is at 13%. And it should be under 5%. So there's just way too much COVID out there. And it's really putting a strain on resources. So we need people to basically stay home if at all possible, avoid congregating indoors next to people. If you have to go to the grocery store, we get that, but just try to stay away from others at least 6 feet, and for sure wear a mask at all times. And if you're at work around others, try not to be together in a break room, try not to eat next to other people, because this is putting a strain on our system.
I'm hearing from many people in the community who maybe are getting COVID fatigue and wanting to get this all over with and get outside and do their normal daily activities. What would you say to those folks who think this really isn't a huge deal right now?
This is a huge, huge deal. And I realize that there's plenty of people who get COVID and recover, but there's also a lot of people who, they have long-lasting effects on their organs. It can affect your heart, your lungs forever. And there are young people who died. Of the 31 yesterday who died, 2 of them were in their 40s. And there have been people who are in their 20s and 30s who died. And even kids who oftentimes are relatively asymptomatic or have very few symptoms, they can spread it to adults. So we really want everyone, the entire public, to take this seriously.
And moving into the holiday season, what is a big concern that you might have?
Well, it's those parties, it's the family get-togethers, and I know people are getting tired. They want to see each other. But unless they're in your bubble, unless you know that they've been quarantining for 14 days, you shouldn't get together. And this is going to be a lonely, hard holiday season. I get it. It's been 8 months since I've hugged my grandchildren now. And so I'm very sympathetic to this. I normally have a big holiday party with 50 people. It's going to be my wife and myself this year. And so we all have to do this. I know it's tiring, but it's going to be a long winter. We've got 5 months or so. We're just going to have to tough this out to save lives. We need your help.
We have to remember that you're there to help keep us healthy, but we have to do our part as well, right?
Absolutely. And if you're sick, and you need to come to the hospital, we're here to help people. And we want people who have chronic diseases like hypertension stuff, go see your physicians, keep that under control, because that helps as well. Make sure everyone gets your flu shot. We don't want to add to the problem with COVID-19.
And Essentia Health has a quick, easy flu shot clinic right up there at the Miller Hill Mall, right?
Absolutely.
Perfect.
If you have any questions, give us a call. We're here to help.
Dr. Pryor, thank you so much for taking the time this morning. We appreciate it.
Thank you very much.